I'm Taylor McFarland. I'm a board-certified pediatric dentist and mother of 3, ages 6 and under. Today I want to share with you a little hack that I use for delivering medication, especially when my children are young. A lot of kids don't like medicine. They try to spit it out if it tastes yucky, and it can be really stressful as a parent, especially when they're sick. You're trying to give them antibiotics, something that they need to have to get better, and they won't take that medicine. I hope that this little trick will help you along the way. If you do find it helpful, don't forget to like and then subscribe, and find me on TikTok and Instagram as the Mama Dentist for more tips and tricks related to how to take care of your little one's mouth and teeth. Alright, so now we're going to go through the retromolar pad area. That is the place that you want to deliver this medication. So the retromolar pad, right there. You follow the teeth back to either where the molar is or where the molar would be if it has not yet come in. And then right behind that is this little triangle of tissue. That is where you're aiming for to put your medicine syringe and squirt a little bit at the time so that they reflexively swallow. It helps because they don't taste it as much back there either. So here, there, right there. You do not have to pull their cheek out to do it. I'm just doing that so that I can show you where it is. This is your syringe. You'll inject maybe 1 milliliter at a time, about 5 times in a 5 milliliter syringe. Squirt. Squirt, squirt, squirt. If you have a child, say you have a medicine that they just have to take, or they risk having to be hospitalized, getting an IV antibiotic, something like that, you can have another adult help you, kind of recline that child back. Someone holds the child and holds their lips out of the way. Like this. They can't spit if their lips aren't able to touch together. So someone can hold their lips kind of out of the way while the other adult delivers that medicine back behind that retromolar pad, and that can help them to swallow a medication that they really need to take in order for their health and safety. What I did with my youngest is during teething, sometimes they get dehydrated. It can be really helpful to give them some water just to help manage that low-grade fever and also to keep them comfortable. But delivering water via this syringe at a time that is low stakes, so they're not uncomfortable, they're not teething, they're not sick, you're just practicing, is a great thing to do. So if you've got a child just sitting, eating happily in their high chair and you want to practice delivering medication, just fill this syringe with water. Give them little squirts, make it a game. It can be great to practice and desensitize them to giving medicine so that at a time when they're less able to compensate, when they are sick, when they are uncomfortable and they don't feel well, you will have better success at giving that medication. So those are my 2 tips, the retromolar pad and then making it something playful, making it fun. Practice delivering water through this medication syringe at other low stakes times. Let me show you real quick on the typodont what that looks like too. So here is the typodont. Open them up. Back here would be kind of the throat and then the gummy tissue between the jaws, and then the retromolar pad is just right here. So you would be going back along the cheek, and then you're aiming that retromolar pad kind of right back here, and it's squirting back into the throat. And they don't really taste it as much, and they have to swallow reflexively when it's back there. You're just injecting a little bit at a time. I hope that helps. All right, so now you've gotten my 2 best tips for delivering medication to a child via medicine syringe. If you've got any other questions, anything else you think I might know and would like to ask me, please let me know in the comments. Also, like this video if it was helpful. Don't forget to subscribe. And then next up, YouTube's going to show you what they think you'll enjoy watching next.